Hi, it's Paul. Let's look at the benign findings in urinary tract cytology. This is a low power urine. It's a moderately cellular one. Most of the cells here are urothelial. There'll be scattered squamous cells. We're going to concentrate on urothelial cells because we've looked at squames. You can see they're a lot like squamous cells. They have a central nucleus and a moderate amount of cytoplasm. But the cytoplasm, notice, is sort of more transparent. It's less homogeneous. Nuclei are round and oval and pretty uniform, and the NC ratio is not terribly high in these cells. Chromatin is fine and even, and you'll notice there's little nucleoli often present in urothelial cells. This is an umbrella cell. It's one from the superficial layer, outermost layer of the urothelium. It's multinucleate, fairly prominent nucleoli. That's not unusual. See this cell down the bottom left hand corner? This is a degenerating urothelial cell, and often they have these eosinophilic bodies in them. It's just a degenerative change. So bi and multinucleation are both fairly common in urothelial cells. This is quite a cellular and slightly reactive case. So cells here are a little more cohesive. Notice that the nucleoli are quite prominent, but chromatin is still fine and even in these. No really high NC ratios. So the NC ratio of urothelial cells depends on what level of the epithelium they have been sampled from. You'll notice there's a mixture here from sort of larger urothelial cells that are bi and multinucleate down to smaller ones about the size of a squamous metaplastic cell in terms of NC ratio. This is what you commonly see with reactive changes in the urothelium. You get more cell groups like this, and they have a sort of uniformity to them. Usually the individual cells in them don't have that high an NC ratio, and so they tend to be not super crowded. They often have a scalloped outline to the group, so you can see the cytoplasm of the cells around the outside of the group forming a sort of scalloped shape. Often in these groups you'll see quite a lot of vacuolation of cytoplasm as well, and sometimes quite prominent nucleoli. So crystals are just really an incidental finding in most urines, and they vary enormously. Here's one that looks a bit like a moth down the bottom left there, and these we don't report. These are really cool under a polarizing microscope where they do sort of rainbow colors, but I didn't have a polarizer at hand here at the moment. Casts are something that we do report, and these are a sign of renal damage. Here's a sample that's mainly squamous cells, but it has these worm-like casts in it. You can see they have tubular shape to them with parallel sides and blunt ends, and these can be cellular or just granular. This one probably is red cells, I think, and sometimes they'll have a kind of waxy appearance and be acellular. Here's just another group. These are definitely red cell casts. You can see the outline, the ghost of the red cells in them. And this is a case that's got extensive casts all over it. And some of these are cellular casts. So see this one down here has little dead pycnotic cells in it. These are renal tubular cells. So sometimes casts will come out with degenerate renal tubular cells present in them. There's another one there that seems to be cellular as well. But normally we don't see cells from the kidney in urine cytology, and we certainly don't see renal cell carcinoma. So the most significant infection is human polyomavirus, and it shows typical viral change to the nucleus. So These are the cells. They have quite a very high NC ratio, which is a little worrying. But notice the chromatin on these is just glassy and bland. It's got no granularity to it at all, and it's marginated. There's just incidentally quite a lot of crystals in this, but these are polyoma virus infected cells as well. So these are known as decoy cells also because they can mimic high-grade urothelial carcinoma cells. They have a very high NC ratio. In addition to that glassy appearance to the nucleus, polyoma virus infected cells sometimes have what's called ropey chromatin, which looks like this, and it again is a degenerating change. Now, one other appearance that polyoma has is often this little tag of cytoplasm coming off the cell, and these are known as comet cells. So one of the keys to identifying polyoma virus and distinguishing it from urothelial carcinoma is that usually these are in low numbers. Here's another nice field of varying changes that are all polyoma. So just wanted to show you one other thing we occasionally see, and this is from returning overseas travellers, and this is eggs from schistosomiasis. This is Schistosoma hematobium. You can tell because it's got that hind spur on it. And these have little myristidia emerging out of the egg down the bottom there. Here's one with a myristidium lying beside the empty egg. And I think on this one you can see the cilia around the outside of the myristidium, the larval stage. So in summary, urothelial cells look a lot like squamous cells with a central nucleus and a moderate amount of cytoplasm. That cytoplasm though tends to be less homogeneous, more vacuolated and transparent, not as thick. They usually present in single cells and in groups. Bi- and multinucleate cells are quite common, especially the multinucleated superficial cells, the umbrella cells. But like all benign cells, they have a bland chromatin pattern being finely granular and even. Nucleolia are not a useful feature really at all in urothelial cells. In fact, they tend to be very prominent in reactive cases. And degeneration is always a problem in urine, which is not a great preservative for cells, so that complicates the diagnosis often. In summary, reactive urothelial cells often present in groups rather than being single, which is the usual case in urines. They tend to show a fairly low NC ratio with often abundant vacuolated cytoplasm that creates a scalloped outline to the cell groups. Often nucleolia are very prominent. The other major differential with urothelial carcinoma is human polyoma virus, and this can produce very hyperchromatic, very high NC ratio cells. Often they're few in number and they can show a gradation of change from glassiness through to kind of ropey chromatin. But typically they show that viral effect, so very glassy, smudgy chromatin. And usually they're quite low in numbers compared to the normal cells, and that's not normally the case as we'll see in urothelial carcinoma.